Hi, Dr. Harrison here, and today I want to talk to you about one of the most common complaints that our patients come in with, and that is neck pain. First thing we do is obviously a thorough history. We do a thorough examination, and almost always we'll take an x-ray to rule out dangerous things that can develop silently in the body. Once we've ruled out those things, it really boils down to 3 or 4 different things that we see with our patients. The most common is just tight muscles and restricted mobility. So when we examine the patient, when we take the x-ray, we look at all the findings, typically we'll find the spine is in good alignment, nothing is shifted out of its normal position. The proper curvature on the lateral view is going to be there if you're familiar with x-ray. So everything structurally looks normal. It's just that there's a lot of muscle tension deep in there around the spine, and it's restricting the mobility. There are a lot of reasons why neurologically that will generate pain for the patient, and that's usually a pretty quick fix. We get in there, we mobilize the joints that are restricted a few times, and the pain just goes away. So that's the simplest thing that we see when we're dealing with neck pain. The second most common is tight muscles and restricted mobility, but then also we have a shift in the structure. So on x-ray, we might see that one or more of the vertebrae is either rotated out of its normal position, or maybe it's tilted out of its normal position, and you can actually see that on the x-ray. A little bit more difficult to fix than the first one, because now we're dealing with mobility issues, but we're also dealing with a structural issue where we need to try to realign that spine or correct that shift in the structure. So that can take some time, depending on how long it's been developing in there, and sometimes that could be a few days or a week, or sometimes it could be a year or longer. So that's the second most common. Third most common thing that we would see is a combination of those two, and maybe the addition of some arthritis or degeneration in the spine. In that situation on the x-ray, we'll see that the disc spaces are thinning. We might see a bone spur or two forming. The joint is wearing out, and we've got calcium deposition trying to stabilize the area. That's obviously a much more chronic situation. That's something that's probably going to take some time to alleviate the pain. We're going to have to work with that patient a little bit longer, and then they're probably going to need some type of maintenance care to help support that area so that we can slow down the progression of the arthritis. Anytime we see arthritis in the spine, we know that there's been restricted mobility there for a long period of time, and the longer you're restricted in that movement, the more degeneration that takes place. So the way we counter that is, once we get you out of pain, we have to keep that joint mobile, and you can do that through home exercise, massage, and then the adjustments periodically to make sure that we keep the joint moving at the segmental level. And then the last thing that we typically see as far as neck pain goes would be a disc herniation or a disc bulge. Most of you have heard those terms before. Those are the things that people sometimes have surgeries on. Obviously, our job is to try to prevent you from having to go down that road. And if the adjustments aren't enough to take care of the problem and get things back on track, then we might look at something like spinal decompression, which we'll talk about in another video. I hope this has been informational and helps. And if you have any questions at all, please feel free to call the office or contact us through the website. The phone number is 407-522-5858.